In this lesson, we will be discussing bloodborne pathogen standards required by Occupational Health and Safety Administration, also known as OSHA. Germs that live in human blood and can cause disease in humans are called bloodborne pathogens. A pathogen is something that spreads disease. According to the United States Department of Labor, OSHA's Bloodborne Pathogen Standard 29 CFR 1910.1030, as amended pursuant to the Needle Stick Safety and Prevention Act of 2000, prescribes safeguards to protect workers against the health hazards caused by bloodborne pathogens. OSHA requires employers to be responsible. These requirements address items such as exposure control plans, universal precautions, engineering and work practice controls, personal protective equipment, housekeeping, laboratories, hepatitis B vaccination, post-exposure follow-up, hazard communication and training, and record keeping. The standard places requirements on employers whose workers can be reasonably anticipated to contact blood or other potentially infectious materials, OPIM, such as unfixed human tissues and certain body fluids. So let's go over a few of these. Engineering controls. Design safety into tools and workspace. Work practice controls. That is the use of PPEs and following standard precautions, such as not recapping needles, wearing gloves, hand washing, no foods, cosmetics in the work areas where contamination is likely. Categorize the hospital personnel into risk categories and educate them accordingly. Provide education concerning standard precautions, bloodborne pathogens upon employment and yearly. Provide PPEs in appropriate sizes at no cost to the employee, such as gowns, gloves, masks, goggles, eye shields. PPEs must be impermeable to liquids. Employer will make HPV immunization available free of charge. Employer will have post-exposure plan and make the employee aware of it. Precautions require that all blood and other bodily fluids be treated as though they're infectious. Therefore, consider all your patients as if they are infected. Bodily fluids consist of blood, semen, pleural fluid, amniotic fluid, cerebrospinal fluid, synovial fluid, other potentially infectious material, pericardial fluid, breast milk, vaginal secretions, any unfixed tissue cultures, any body fluid containing blood or OPIM. What is missing here? Bloodborne pathogens are not the only pathogens we must protect ourselves from. Therefore, we use standard precautions. Standard precautions are designed for use with all patients. Let's cover some of these standard precautions. They apply to blood, all body fluids, excretions, secretions except for sweat, non-intact skin, and mucous membranes. Listed here are a few main standard precautions that we are going to go over. So wash your hands for at least 10 to 20 second friction rub with soap at the minimum. After you touch blood, body fluids, secretions, excretions, and contaminated items. After taking off your gloves or between patient contact. Wear gloves when touching blood, body fluids, excretions, secretions, and contaminated items. Put on clean gloves before touching mucous membranes or non-intact skin. Change your gloves between tasks, procedures on same client after touching contaminated surfaces, or when gloves become torn or soiled. Between each patient contact. Remove gloves promptly after use and before touching non-contaminated items or the environmental surfaces. Wash your hands immediately after removing gloves. Wear mask, eye protection, or face shield. You do this when in activities likely to generate splashes or sprays of body fluids, excretions, or secretions. Wear a gown that's impermeable when soiling with sprays or splashes are likely. Remove carefully to avoid contaminating clothing. Wash your hands after removal. Soiled clothing should be carefully removed or cut off. Patient care equipment. Handle soiled equipment carefully to prevent contamination or transfer to other clients or the environment. Dispose of single-use equipment correctly. Clean and process reusable equipment according to facility policy. Environmental controls. Follow procedures for routine care, cleaning, and disinfection. Remember HBV. Linens. Handle to prevent contamination of clothing and avoid transfer of organisms, and wear gloves. Bag linens at point of origin. Use gloves to sort soiled linen, but handle as little as possible. Sharps. Never recap unless using one-hand technique, then only if you must. Never bend, break, or remove needle from syringe by hand. Dispose of all sharps in a sharps container. These are color-coded, puncture-resistant, leak-proof, and sealable. Sharp containers should be replaced when half to 3/4 full. Resuscitation. Use resuscitation devices as alternative to mouth-to-mouth. Patient placement. Use private room for client who contaminates environment and who cannot be expected to assist in maintaining environment. Biohazard. Biohazardous material or items containing biohazardous waste must be clearly labeled. Specimens. Collected in leak-proof containers, placed and transported in sealed leak-proof labeled containers. Regulated waste. Liquid or semi-liquid body fluids. Items that would release body fluids. Items caked with body fluids. Contaminated sharps. Disposed of in container, color-coded, sealed, puncture, and leak-resistant at point of use. Spills. Glove. Scoop up glass with dustpan, cardboard, place in sharps container. Blot excess or use absorbent powder like biohazard bags and clean with approved disinfectant, usually a 1:10 ratio bleach solution. What is exposure to bloodborne pathogens? The definition of exposure relates to a needle stick injury or a cut or puncture, splashing of blood or OPIM into the mouth, nose, eyes, or other mucous membrane. Direct, lengthy contact with large amount of blood or other bodily fluids. If exposure does occur, allow the area to bleed freely. Wash area with an antimicrobial soap. Alert your supervisor and fill out incident report. Follow-up care will include HIV and HBV drawn on employee and involved client with the client's permission. Provide counseling. Hepatitis immunoglobulin provide and/or AZT for HIV exposure in some cases. Check antibodies at 3, 6, and 12 months. And keep employee confidentiality at all times. Other potential pathogens that we use standard precautions to protect ourselves are nosocomial infections. Nosocomial infections are infections that originate or occur in a hospital or a hospital-like setting. They are responsible for about 20,000 deaths in the U.S., per year in approximately 10% of American hospital patients. That's about 2 million every year. They acquire a clinically significant nosocomial infection. Most common sites of nosocomial infections are in order from most to least common are as follows: urinary tract, surgical wounds, respiratory tract, skin, blood, GI tract, and the central nervous system. Methods to decrease the potential of a nosocomial infection should include observance of aseptic technique, frequent hand washing, especially between your patients, if possible, use of single-use disposable items, adhering to facility policies related to isolation protocols, institutional methods such as air filtration within the hospital, general awareness that prevention of nosocomial infection requires constant personal surveillance, and active oversight within the hospital. A potential form of exposure to bloodborne pathogens is a needle stick injury. The Needle Stick Safety and Prevention Act was signed into law on November 6, 2000. Because occupational exposure to bloodborne pathogens from accidental sharps injuries in healthcare and other occupational settings continues to be a serious problem. Congress required modification of OSHA's Bloodborne Pathogen Standard 29 CFR 1910.1030 to set forth in greater detail and make more specific OSHA's requirement for employers to identify, evaluate, and implement safer medical devices such as needleless systems and sharps with engineered sharps protections. The Act also mandated additional requirements for maintaining a sharps injury log and for the involvement of non-managerial healthcare workers in identifying, evaluating, and choosing effective engineering and work practice controls. These are workers who are responsible for direct patient care and be potentially exposed to injuries from contaminated sharps. Any worker that can come into contact with needles is at risk for exposure injury. The main occupational worker at risk include nursing staff, lab workers, doctors, and housekeepers. Workers that are in the healthcare environment are generally considered to have the highest risk of having an occupational exposure to blood or other potentially infectious materials. Most exposures are related to the needle stick injuries. Estimates indicate that 600,000 to 800,000 needle stick injuries occur each year. Can you imagine that? Unfortunately, about half of these injuries are not actually reported. Always report needle stick injuries to your employer to make sure that you receive appropriate follow-up care. That is so important. Needle stick injuries can lead to serious or fatal infections. All workers who are at risk should take steps to protect themselves from this significant health hazard. Needle stick injuries can expose workers to a lot of pathogens, especially hepatitis B, hepatitis C, HIV. There are hepatitis B vaccination, and it is recommended for all healthcare workers. It has provided highly effective in preventing infection in workers that are exposed to HBV. There currently are no vaccines that exist to prevent HCV or HIV infections. Do certain work practices increase the risk of needle stick injury? The answer is yes. Past studies have shown that needle stick injuries are often associated with such activities as recapping needles, transferring a body fluid between containers, and failing to dispose of used needles properly in puncture-resistant sharps container. How can the nurse be protected from needle stick injuries? Avoid the use of needles where safe and effective alternatives are available. Help your employer select and evaluate devices with safety features that reduce the risk of needle stick injury. Use devices with safety features provided by your employer. Avoid recapping needles. Plan for safe handling and disposal of needles before using them. Promptly dispose of used needles in appropriate sharps disposable containers. Report all needle stick and sharps related injuries promptly to ensure that you receive appropriate follow-up care. Tell your employer about any needle stick hazards you observe. Participate in training related to infection prevention and get a hepatitis B vaccination. This is the end for part 1 of Bloodborne Pathogens.